Hello, I'm Dr. David Greene with PreferredPainCenter.com, where we bring you anything and everything education for pain management. Today the topic of discussion is hormone abnormalities and chronic medication management with narcotics. This is a big problem and one that we didn't know really existed a lot until recently at the American Academy of Pain Medicine. A research study was presented that looked at over 20 patients who had each been handled with medication management for over 10 years each. And they found that when studying the hormone levels of these individuals, that well over 90% of them had vital hormone levels that were off, either deficient or high. So the biggest one was testosterone. In over 50%, there was a significant reduction in levels that were normal. The other one was follicle stimulating hormone, which is not as well known, but it is still a problem. So when you look at what testosterone actually does, it's extremely important to both men and women. You know, in men, it helps a lot with muscle mass protection, bone structure, mood, energy, libido. There's just a lot of things that it really does. So when they asked these patients at the beginning of the study, you know, how are you doing? The answer was pretty much overall, I'm doing fine. But when they went back and said, well, you have these problems, how are you really doing? When they started asking specific questions, they did have issues with mood, energy, libido, difficulty sleeping. You know, so this is a real problem. So the recommendation out of the study was, first of all, to check hormone levels in patients who were on chronic opiate medication management. Now there was a different second aspect to the study. They found elevations in certain hormones, one of which was cortisol. Cortisol is the body's own steroid that it makes from the adrenal gland, and it's also extremely important. But you don't want to have too much of it on a chronic basis. So cortisol levels can be increased due to stress. So the researchers thought, well, maybe they have increased cortisol because they have increased stress due to pain. Is their pain being well controlled enough? So they recommended further research to see if cortisol could be used as an indicator of inadequate opiate medication management. So if you have excess cortisol, maybe you're not on either the right medications or the right dosage, or maybe it's time for a new round of epidural injections or facet blocks or something to help, you know, bring down that pain level, lower the stress, and bring cortisol levels down. That was one of the things that they recommended. I think it's a great idea, because anything that pain doctors can do to bring down pain levels in patients safely is, you know, the future of pain management. Check out our website at PreferredPainCenter.com. The phone number is 602-507-6550. We work here in Arizona with Arizona pain specialists. They have double board certified pain doctors who handle medication management along with interventional procedures, physical rehabilitation, chiropractic treatment, acupuncture, spinal decompression therapy, and more. So the new paradigm for pain management is a comprehensive options, of which Arizona Pain Specialist has that at all of their locations around the valley, and they take a ton of insurances. Our website has a lot of education on it. If you click on the Education tab, you can see a lot of information about various pain conditions. I'm Dr. David Greene, PreferredPainCenter.com. Your pain stops here.